I don't have any financial affiliations with any of these companies, by the way, and I apologize for using a brand name. Avoiding complications with hyaluronic acid. Obviously, there's been quite a change. At least this numbers are from Medicis in terms of reducing some of the allergic profile. The great thing is, you know, with any hyaluronic-based product, you can reverse it using hyaluronidase. And I'm going to talk to you about some of the numbers that I used so that you don't dissolve everything. I've really found using blunt cannulas around the eyes allow me to fill each of the eyelids really quickly in less than 5 seconds per eyelid in a supraperiosteal plane using these cannulas. I jokingly refer to this cannula I developed with Tulip called the Laminator, but I don't make any royalties off Tulip or receive any compensation from them. Again, I don't have any financial affiliation with Tulip, but they make great products for injecting around the eyes. This is a disposable cannula, and just showing how I actually inject Restylane and Juvederm and all those hyaluronic-based products the same way that I inject fat, which is just around the orbital rim in a supraperiosteal plane using this blunt cannula. Calcium hydroxylapatite. A few things of pearls that I've been using it for about 4 years now, and I just want to go through some of the things that will keep you out of problems. I used to do some cross-hatching techniques for volume fills of the cheeks, had some lumpiness, and really what I do now for volume fills of the cheek is a transoral approach where I go up and actually target the maximal area of depression, which is the malar linear depression. By filling a linear depression, you get the maximal benefit, but since you're going through a transoral approach, you're going up and down and creating a scaffold, and doing that eliminates that bulge. I've really found some problems, idiosyncratic responses around the nasolaryngol area. I don't like using calcium hydroxylapatite around the eyes or the lips. Another little pearl is that if you're injecting the labiomandibular fold, there's a fine line between injecting it into the fold itself and injecting it into the mucosal side. So what I always do is, after I fill the labiomandibular fold or puppet line, I'll go in there with my index finger, my non-dominant hand, and just feel if anything's extruded in the wrong direction, and then gently manipulate it back in the right direction, and not pressing it out with 2 fingers, but just using 1 finger. These are just some of my volume fills, a cc of Restylane around each eye, and then that's Juvenile Ultra Plus into the cheeks and jawline. That's 1 cc into the cheeks, 1 cc into the jawline. This is Radius, 1 syringe into the cheeks and jawline total, and then 1 cc of Restylane into under each eye using the cannula approach. This is Perlane, 1 into the cheeks, 1 into the jawline, and then 1 cc of Restylane per lower eyelid. Polylactic acid is a product I don't use very much, only because I found it to be quite expensive and not really able to deliver what I want on a timely basis. Most patients that come in to have a treatment, they want it yesterday, the results. So the things that probably you're already familiar with, this is more something I think it's in a textbook by this point, which is just making sure you dilute it sufficiently and mixing it the night before, and then on the day of the procedure adding a little bit of lidocaine. I always want to over dilute than under dilute, and really go over a wider area. I don't think it's a great treatment for lips or noses, because you're almost sort of predicting what it's going to turn out to be, and I usually just use it for cheeks or jaw lines, and I really am conservative with doing it over treatment of every 4 to 6 weeks, and I do a little bit of massage into that area just to make sure it's okay. I do a 3-minute, 3 times a day for 3 days rule.